Kevin Bradley has been a corporate trainer for 25 years when he enrolled in seminary full-time. He was ordained in the United Church of Christ and has served as a chaplain for several healthcare organizations, including the Mayo Clinic Health System and the U.S. Department of Veterans Affairs. His specialty areas include mental health issues such as post-traumatic stress disorder, depression, and addictions. He is also certified as a critical incident stress management counselor and is now a stress management consultant. Today, Kevin is going to share how he has used SQ21 as a hospital chaplain. Take it away.
Real quick, how many chaplains do we have out there? Okay, how about prayer chaplains also? Same. Okay, so some of you know some of this work. One of the most prevalent parts of preparing and training for being a professional chaplain is called clinical pastoral education. So chaplains know about this. By the way, this is my company name. I'll talk about that a little bit later on. Clinical pastoral education, otherwise known as CPE. In order to be a hospital chaplain, you usually have to have at least 1 unit of CPE. 1 unit of CPE is 300 clinical hours plus 100 instructional hours. To be hired as a staff chaplain for most major organizations requires 4 units. I was very fortunate. I ended up with 6.5 units, 6 of them as a chaplain resident at the VA hospital in Sioux Falls. One of the things I want to talk about is the fact that, and this is what really drew me to SQ21, I was introduced to it, and the overlap between SQ21 and CPE is huge. The most important part to me for CPE is it's all about self-awareness. Specifically, it's knowing how my story affects me as a chaplain. Oftentimes, I'm surprised to find out nurses think that they can check their emotions at the door and go in and, the whole clinical attitude of it. Chaplains are trained to know, I cannot check it in the door. I have to know how my story affects me. Specifically, my story, just so you know, back up here. My story, I know, partly because of my CPE training, I cannot see a man with lung cancer without thinking of my dad. I cannot see a woman with facial injuries without thinking about my mom and the car accident that we were in. I cannot see somebody with PTSD, depression, and addictions without thinking of my son. And I have to know that going in the door. I'm just going to share with you some stories, 3 brief stories of patients that I have worked with. Jake was diagnosed with stomach cancer at the age of 15. I met him the year later. His cancer had gone into remission after the normal treatments, but had come back, and he was checked into a hospital. That's where I met him. He did not want treatment. At the age of 16, he did not want treatment. He said the treatment was worse than the cancer. Well, the dilemma is that he's 16 years old. His grandmother is the legal guardian. He's in the white man's hospital, and I specify white man because so far that story is not unusual. What made this story unusual is that Jake is a Lakota Sioux. On the reservation where he lived with his grandmother, he had already gone through the rite of passage that made him an adult in the eyes of his people. But he's in the white man's hospital. Grandma gets to say whether he gets treatment, and she wanted him to have treatment. So the chaplains were all brought in for this big ethical dilemma. What do we do? What do we do? To me, the bigger story was the relationship between Jake and his grandmother. Because I knew that their story was about the cultural tradition and the fact that you cannot take spirituality out of Native American culture. It just cannot be done. It's embedded and it's woven throughout. Well, like I said, on the reservation, Jake's decision, because he had gone through the rite of passage, would have been honored. It might have been questioned by the elders, but it would have been honored. There would have been no part of discussion as to whether or not he would be forced to do it. The dilemma was resolved because grandmother agreed to honor Jake's decision. and he passed away a few months later. Lisa. Lisa was a mental health patient, one of my first, and I was really struggling, and I was really glad that I didn't give this talk before Cindy spoke, because I was all prepared to talk about how I think all mental illness is a spiritual injury and you shouldn't use drugs at all. Well, that's actually a constant evolving conversation I have with psychiatrists. I am going back and forth in my own mind as to, are drugs ever necessary? I talk with people, especially among chaplains, who think that mental illness is always a result of a spiritual or emotional injury. The psychiatric model, which is to use drugs sometimes, even if it's only at a basic level, because sometimes the patient needs drugs in order to function well enough to address the deeper issues. The problem with that model that I'm finding in my work as a chaplain is that sometimes a deep wound can only be healed at the fullest depth of that wound. And if you are using any drugs whatsoever, that depth is veiled, and you don't get there. It's going to be an ongoing conversation for quite a while. So Lisa came into the hospital, and she checked herself in more or less out of habit. She would come in, she would get checked out. More likely than not, she would have her medications adjusted. She would be sent home, fully prepared to repeat the cycle in about 6 months. She was tired of the revolving door of the pharmaceutical psychiatric world. She cried throughout most of her first visit and said, "I don't like the drugs, but I don't know what else to do." She talked about the fact that she was unable to control her emotions. She was diagnosed as bipolar, that's what it's all about. She also talked about the fact that she felt angry. Well, then she talked about being guilty, that she was angry, and those two emotions work together to often trigger a depressive episode. Over the course of several visits, I taught her some breathing exercises. I taught her the wonderful exercise that I learned from the SQ21 about changing your emotions by changing your thoughts, using, name 10 things you like about Minnesota, hate of Minnesota, and see how you changed. That was a huge eye-opener for her, and I use that exercise a lot, by the way. I also taught her a thing about the hidden gifts of so-called and negative emotions, fear and anger, and I gave her a one-page summary of the 4 agreements, which is my go-to resource. Lisa was an artist, or she had been. 3 years earlier than when I met her is when she had her first breakdown. She gave me this at her discharge. I don't know if you can see this. It says, "To Pastor K." It was the first thing she had been able to finish. 2 years. Paul. Paul was, by all appearances, a healthy man in his early 40s when he sustained a serious head injury. He was brought into the ER by ambulance. Now, in the ER, unlike the rest of the hospital, in the ER, the chaplain's job is to take care of the family. In this case, the family was Catherine, his mother. And she was as close to a complete emotional breakdown as I'd ever seen. I was convinced that if I moved 1 inch, she was going to fall on the floor because she was hanging on to me so tight. Many times I've come home with bruises from family members hanging on to me in the ER. So they stabilized Paul as much as they could, breathing tube, ventilator, and as they usually do, they transferred him to the ICU. Par for the course, we would not know for at least probably 18 hours whether or not his injuries would prove to be fatal. That was the case. The next day, it was determined that his brain had probably stopped functioning before he ever got to the hospital, which is not unusual. So it was time for the family to say goodbye. The ICU nurse called me. "How soon can you get here?" "Why? What's the problem?" "Well, Paul has a 10-year-old son who's on the way to the hospital." They didn't expect him to take it very well, as you can imagine. So I said, "Sure, I'll be there right away." So I got there fairly quickly, and I was in I checked into the nurse's station right across the hallway from the ICU room. Looked something like that. From where I was, I could see, of course, all the things going on, and there were 5 or 6 people milling about. Of course, Paul in the bed and the nurses and whatnot. Catherine was at the foot of the bed, clutching a bunch of tissues in one hand, her other hand leaning on the bed rail, and every once in a while, that right hand would move and smooth out the blanket covering her son's feet. Now, I need to take you back to another story. 35 years earlier, I was in college. My dad had died of lung cancer earlier that year. Now, later on in the year, 3 of my college classmates and I went to a movie called The Champ. Anybody remember that movie? Okay. Spoiler alert. Okay. We went to see The Champ. The Champ is about a former boxer who had sustained a lot of heavy blows to the head and told you should never fight again. He had an 8-year-old little boy played by the lovable Ricky Schroeder in the movie, and he was about to lose custody of his son. He wanted to fight one more time in order to get the prize money to help his son. He fought the fight, and he won. And then he died in the dressing room. And little Ricky Schroeder, as an 8-year-old boy, he sees his dad's eyes close for the last time. And in what has been described as perhaps the most heart-wrenching movie scene of all time, little Ricky Schroeder's character says, "Wake up, champ, wake up." Well, movie went on. We got in the car to go back to college campus. And one of my classmates said, "I bet that brought back memories." Well, I don't recall whether or not I was thinking about my dad at that moment, but I certainly was after that comment. So now fast forward back to the ICU. I had calculated where to position myself so I could support Catherine. I was about to cross into the room when all of a sudden little 10-year-old Danny runs in, throws himself across his dad and screams, "Wake up." In that moment, my mind went to Ricky Schroeder, "Wake up, champ." And because of the previous association, then my mind went to my dad. Tears welled up. Like, okay, where am I? And in that moment, I made a conscious decision. I have to do this. I walked around the corner, took several slow, deep breaths, got recentered, and came back around, fully expecting, when Catherine saw me as the chaplain, to repeat yesterday's incident. But instead, I witnessed a total transformation. Catherine stood up, completely regained her composure, and found enough of her own inner strength to not only support herself, but to comfort her grandson. I like to think that moment was made possible, partly because I was self-aware enough to know that I wasn't centered enough to go across the room. It was mostly unconscious. We talked about unconscious competence. I walked around to get centered, came back, not knowing that unconsciously I was creating a sacred space for those two to have that healing moment. This is my company logo, and I want to bring it up again because I'm very sensitive to cultural appropriation. I had a conversation with Jake and his parents, or his family, about the fact that someday I hope to do something about spirituality in the workplace, and I'm always looking for inspiration for a company name. During the visit, I had referred to the relationship between him and his grandmother as a sacred one. And the reason for that, and I need to point this out, is that the reason he lived with his grandmother is that is a Lakota custom for the oldest child to be raised by the grandmother so that the wisdom of the elders could be passed directly on to the child. And with Paul, I had seen Catherine being transformed from a grief-stricken mother to the wise elder for that grandson. Those are the connections that I made. So after I talked about the relationship between Paul and his grandmother's being sacred, and the fact that I was looking for a name for my company, they told me that this word, which is pronounced Wakan, it is a Lakota name which means sacred. It's a lotus flower. getting verklempt here, and he invited me to use it for my company name. So thanks for listening. I just want to add a final note that I am in conversation with the Director of Spiritual Care for the Allina Healthcare System, which is the largest hospital network in Minnesota, about bringing SQ21 into their CPE program. So that'll be pretty cool.